Good morning, sir. Today I will be performing the abdominal return demonstration, assessment of abdominal return demonstration. So, first that we need to do is to gather all the equipments para madali siyang makuha if kailangan na natin, and also makasave tayo ng time, energy, and effort. And next is we need to explain the procedure to the patient. Good afternoon, sir. I am Mark Edsel Villador, and I will be your student nurse for today. Sir, may I ask what is your name, please?
Christian Villador,
How old are you, sir?
15,
What is your birth date, sir?
November 6, 2006.
Thank you, sir. It is important to identify the patient para makasigurado tayo na we're doing the right procedure to the right person. And next is we need to explain the assessment, the procedure to the patient. So today, sir, we will going to assess your abdomen to check for any abnormalities. Would it be okay, sir? Thank you, sir. So it is important to explain the procedure to the patient para makapag-cooperate si patient at hindi siya mabigla while we're doing the procedure. And next is we need to ask the client to put on the examination gown to provide privacy to the patient because we only need to expose the abdominal part of the patient. So let's proceed to the assessment of the abdomen. So first we need to do is ask the patient to lie down on the bed with a pillow to support for comfort and para hindi magkaroon ng construction sa abdominal muscle ng patient. So sir, can you lie down on the bed, sir? So after asking the patient to lie down on the bed, we need to put our gloves on. So para hindi, if ever na may lesions patient, hindi ma-transfer yung fluid at hindi ma-infection yung lesion or tayong nurse sa body fluids na lumalabas sa lesions if ever na merong mga scars and lesions. So next is we need to inspect for the skin color and also the vascularity, presence of lesions and scars, and also striae. As we can see, the abdominal part of the patient is paler or whiter than the normal skin tone of the patient because it is less exposed to the sunlight because of our clothing. So it is normal to have a lighter color, and so we need to inspect also for the scars and lesions. So as we can see, there is no open scars and lesions to the patient, which is a normal, and there is no presence also of striae to the patient or striae or the stretch mark. So wala po siya nun. And next is we need to inspect the umbilicus of the patient. Is also titignan natin yung color, yung location and contour of the sir, pwede pong sir. So as we can see, the umbilicus of the patient is kakulay ng abdominal skin color ng patient, which is normal. Also, it is not protruding, and its location is in the midline of the body part of the patient, which is signs of normal findings. So, kailangan is nakagitna sa sternum natin yung umbilicus ng patient, and also walang other open lesions and protruding or scars na makikita sa umbilicus ng patient. So next, we need to inspect the contour of the abdomen. So as we can see, the abdomen of the patient is semi-round or flat, and it is normal. So for the patient, and no signs of enlargements of any intestines or abdominal parts of the patient or enlargement of organ of the patient. And next is we need to inspect the symmetry of the abdomen. So as you can see, the abdomen of the patient is symmetrical, which is signs of normal findings also. So as I was saying, there is no mass in the hard masses in the abdomen of the patient and no enlargement of internal organs, which is a normal signs. Next is we need to inspect the abdominal movement, noting the respiratory movement of the patient, aortic palpation and pulsation, and peristaltic waves of the patient. So as we can see, as the patient breath, makikita natin yung movement ng abdomen niya and no sense of difficulty of breathing for the patient. So as we can see, the aortic pulsation of the patient. We can see here in the aorta part of the patient. So it is visible because the patient is a bit thinner than the other uh, uh, patients. For the peristaltic waves of the patient is hindi po siya natin gaanong makita kasi hindi ganun kapayatan yung patient. Pero if ever the patient is thinner, we can observe the peristaltic waves of the patient. After inspecting the abdominal movement of the patient, next is we need to auscultate for the bowel sounds and noting its intensity, pitch, and frequency. So we will using our stethoscope and make sure that the diaphragm of the stethoscope is warm, so para hindi ma-shock yung abdomen muscles of the patient and hindi magkaroon ng constriction. Because if ever na magkaroon ng constriction sa muscle ni patient, pwedeng ma-alter yung uh, results na makuha natin. So make sure that it is warm. And make sure it is warm. Next is we need to apply the diaphragm on the right lower quadrant of the patient using light pressure and count the constriction that we can hear for 1 minute. So mag-start tayo sa right lower quadrant of the patient and pakinggan natin yung mga bowel constrictions and the intensity of the sound waves. So, after 1 minute of auscultating the right lower quadrant of the patient, we heard 26 vowel sounds, which is soft click sounds, and also irregular, which is a normal signs of when auscultating the abdomen of the patient. So, and again, gagawin ulit natin siya pataas in a clockwise rotation. Next, sa ano naman, sa right upper quadrant. So, tulad kanina, nakarinig tayo sa patient na irregular soft clicks, gurgles sa abdomen ng patient, which is normal, and also wala namang chief complaint si patient. So, let's proceed sa left upper quadrant of the patient. So next is in the left lower quadrant of the patient. So after assessing, auscultating the abdomen of the patient has a irregular soft gurgle sound and also has 26 counts of vowel sounds, which is normal. So kapag hindi tayo nakarinig ng any vowel sounds sa patient, is maximum of 5 minutes natin siyang kailangan pakinggan if ever na wala tayong vowel sounds na ma-auscultate sa patient. Next is we need to auscultate the vascular sounds and friction rubs of the patient. So, using the bell of the stethoscope, i-place natin ito sa may aorta part of the patient, and here for any soft murmurs, and normally dapat wala tayong marinig na soft murmurs or sounds sa aorta part of the patient, also in the iliac and femoral aorta of the patient. So, after auscultating the aorta of the patient, there is no presence of murmur sounds, which is normal findings. So, next is we need to auscultate the renal artery of the patient. So, wala po tayong na-auscultate na low frequency murmur sounds of the patient, so which is normal findings po. Next is we need to auscultate for the friction rubs of the patient. I-place natin yung diaphragm na stethoscope sa lower rib cage ng patient, left and right, to assess for the friction rub for the liver and the spleen of the patient. So, as we auscultate the patient, wala naman tayong narinig na friction sounds sa parts ng patient, so which is normal findings din. The auscultating next is we need to perform the third technique, which is the percussion of the abdomen for the tone of the patient. So, normally, makakarinig tayo ng tympanic sounds sa abdomen part of the patient because it consists of air because of our internal organs in the air in our abdomen. So, in percussion, we need to start in the right upper quadrant of the patient in a clockwise motion. So, repeat the percussion process until we reach in the right lower quadrant of the patient. So, as we can see, or hear, we hear a tympanic sounds over the abdomen of the patient, except for the parts of the liver, which is normally dull, and also in the spleen of the patient. Normal lang siya na dull sounds ang marinig natin sa kanya. So, next is we need to percuss the liver of the patient. By doing so, instruct natin si patient na mag-take ng deep breath and hold. And after the patient holds deep breath, we need to start the percussion by dapat makarinig from the right lower quadrant of the patient in the mid-clavicular line. So, dapat makarinig tayo ng tympanic to dull sounds. Pag nasa dull sounds na ang naririnig natin, stop and mark using a marker. And repeat the process to get the apex of the liver. So, sir, can you take deep breath po and hold it po? So start in the right lower quadrant. So after hearing the dial sounds, let's put marker and exhale po. So again, sir, take a deep breath. So from dial, pag nakarinig na ulit tayo ng tympanic sounds, stop and put a marker. Sir, exhale. And after putting the lines or marks, we need to measure using our centimetric ruler. And after marking, we need to measure use. So as we can see, the line of the mark, line to line, is 8.5 centimeter, which is pasok sa normal size ng liver of the patient, which is from 8 to 12 centimeters. So again, uulitin natin dun sa next is we need to repeat the process again. Now this in the midline of the patient. So take a deep breath po and hold. So start in the middle. So after hearing a dull sounds, line 8, put a line and inhale. Exhale. So repeat. After hearing the tympanic sounds again, after the dull sounds, put a line again and measure. So as we can see, it is 4 centimeter long, from line to line of the border of the liver of the patient. Next is we need to perform deep scratch test of the patient. Using the stethoscope and the diaphragm, place the diaphragm of the stethoscope in the xiphoid process of the patient and scratch so pag may nagbago sa sounds, which is normal yun, so ayun, the scratch stops at the lines where na pinunta na mark natin kanina sa mga borders ng liver. At after performing the scratch test to the patient, next is we need to percuss the spleen of the patient. So next, lumipat tayo dapat sa left side ng patient when percussing the spleen of the patient. So we will start at the mid-axillary line of the patient. And dapat makarinig tayo ng from resonance to dull sounds. And kapag nakarinig na ulit tayo ng resonance, iline natin, which is yun na yung magiging borders ng spleen ng patient, and measure it later. So, downward ang pag-percuss natin. So, using our dominant hand ang pag-percuss para makontrol natin yung lakas. So, for the dull sounds, mark a line and so after hearing resonant sounds again, mark and measure. So for the normal size of the spleen, it is normally at 7 centimeters. So, as we can see, the size of the spleen of the patient, the dull sounds, is at 7 centimeters, which is normal. And if ever na mas malaki pa sa 7 yung nakuha natin, so kapag mas malaki sa 7 centimeters ang nakuha natin, possible na merong splenomegaly of the patient or the enlargement of the spleen of the patient. So next is we need to perform blunt percussion on the liver and at the kidney of the patient. So by doing so, we need to place our left hand over the lower rib cage of the patient and use our dominant hand to control the pressure and ask the patient to deep breath and So, and as we can see, palpable yung liver ng patient, which is normal. And also, kailangan natin i-control yung pressure when percussing, because if too hard, pwedeng may ma-rupture or ma-damage na organs sa body system ng patient. We need to perform the blunt percussion on the liver and at the kidney of the patient. So by doing so, we need to put our left hands over the right lower rib cage of the patient, and using our ulnar surface of the hands, dapat yung, as you can see, the patient has no violent reactions or it reports any pain on the liver of the patient, which is a normal signs for the patient. Next, in performing blunt percussion on the kidney of the patient, ask the patient to sit and at the postovertebral angles. So, at the 12 rib cage of the patient, perform the blunt. So, as we can see, there are no tenderness and signs of pain at the kidney part of the patient. So, assist the patient to lie down again. Next is we need to perform light palpation, noting tenderness or guarding in the all quadrants of the abdomen of the patient. So, when we say light palpation, we need to, using our fingertips, we need to palpate the quadrants of the patient using at least 1 centimeter before assessing for any tenderness. Right upper quadrant. So as we can see, there is no signs of guarding or pain at the abdomen of the patient, which is normal. After performing the light palpation, next is we need to perform the deep palpation and noting for tenderness or masses in all quadrants. Also for the pain. So when we say deep palpation, it needs to be pressed, or the force should be 5 to 6 centimeters. So in performing the deep palpation, using our non-dominant hand over the dominant hand, because kailangan natin gamitin yung dominant hand sa pag-pressure para makontrol natin, para wala tayong ma-damage na organs ng patient. So start again from the lower upper. As you can see, walang pain na pinakita si patient or any guarding behavior, which is normal, and no signs of masses also. Next is we need to palpate the umbilicus of the patient. So, observe for any bulge or scars or lesion of the surrounding of the umbilicus of the patient. So, as you can see, wala naman lesions and no tenderness and bulge present. Next is we need to palpate for the aorta of the patient. So we need to use our thumb and our first finger in the midline. And normally the size of the aorta of the patient, approximately 2.5 to 3 centimeters with normal pulse and also possible for mild tenderness to the patient. Next is we need to palpate for the liver of the patient, noting its consistency and tenderness. So, in doing so, put our dominant hand over the lower rib cage of the patient and our non-dominant hand to support at the back of the patient, and ask the patient to take a deep breath. So, we can normally we can palpate the liver of the patient, which is normal for the patient na hindi natin mapalpate yung liver niya. Next is we need to palpate for the spleen of the patient and noting its consistency and tenderness also. Put our non-dominant hands over the posterior costal margins of the patient and our dominant hand over the margin, costal margin of the patient, and ask the patient to take inhale and palpate and release. So it is normal that we can palpate the spleen of the patient, and also and it is soft and non-tender. We need to perform palpation at the kidney of the patient. First, we need to support our left hand at the back of the patient, and our dominant hand the right lower quadrant of the patient, and ask the patient to inhale. So inhale and palpate. So the kidney of the patient is non-palpable. It is normal because the patient's body type is quite big. And also there are no signs of presence of masses at the kidney of the patient or cyst and tumor. Next, we need to palpate for the distant bladder of the patient. Start the palpation at the symphysis pubis of the patient by
Wait lang. Wala na siyang storage.
upward to outward. So the bladder of the patient is palpable, non-palpable, I mean, kasi kanina before we start the assessment, I asked the patient to empty his bladder by urinating. So it is normal and no signs of tenderness and presence of solid masses. If we suspect that the patient has ascites, next is we need to perform the test for shifting dullness. So in performing, let the patient lie on a supine position and start percussion at the sides of the patient. Kailangan may marinig tayong dull to timpani sounds. So, dull to timpani. So, it is normal from dull to timpani sounds. And next, we need to ask the patient to and from here naman, dapat percuss from dull to timpani agad. So as we can see, as the patient changes position, the borders of timpani and dull sounds remain constant at hindi siya nagbabago. Perform the fluid wave test. So put our hands at the sides of the patient and ask the patient to put his hand in the middle of the, and slightly tap. And as we can see, there is no fluid wave that is present, which is normal for the patient. Next is we need to perform test for appendicitis. So first test is the rebound test. So wherein ipe-press natin yung left lower quadrant ni patient and suddenly release the pressure and observe natin if may guarding or pen sensation yung mararamdaman ng patient. So sir. So as we can see, there is no sense of pain or tenderness at the lower left quadrant of the patient. Next, we need to perform the pulse test by asking the patient to circle side po. And pull the legs of the patient and observe if the patient has pain na naramdaman. So wala po siyang naramdaman, which is a normal signs. After the sign, next is the obturator sign. So ask the patient to supine position And flex the knees upwards and observe if there is abdominal pain. So, walang abdominal pain na present sa patient, yung ginagawa natin yung obturator sign, which is normal. Next is we perform the hypersensitivity test, where we need to get a object and repeat strike at the abdominal wall of the patient. So observe for the behavior of the patient while striking. So as we can see, there is no pain presence when we are striking the object at the abdominal wall of the patient, and no exaggerated sensation. So it is normal. After performing the test, hypersensitivity test, next we need to perform a test for cholecystis for the patient, or the Murphy's sign, by pressing our thumbs at the upper right quadrant of the patient at the lower rib cage, and ask the patient to inhale deeply. Press our thumb and ask the patient to inhale deeply. So inhale. As we observed earlier, when we press the thumb, there is no pain or sign of enlargement of the gallbladder at the patient, so which is a normal signs. For the analysis of data, first we need to formulate nursing diagnosis. I-assess natin kung ano yung mga na-observe natin kanina, and make a diagnosis na makakatulong sa patient, and also make necessary referrals kung need ng patient ng further assessment ng physician or other person in the health or medical field. So that's all for my return demonstration for the abdomen assessment of the patient.